Consent is important throughout the medical process because patients need to be informed and tell their medical professionals that they are happy to have the treatment that they're having. It's all centered around the autonomy pillar of medical ethics. Consent can either be verbal, where they simply tell their healthcare provider that they're happy for a treatment, or it can be written. Normally, written consent is for procedures such as surgeries or other medical procedures. Consent normally applies to those who are over the age of 18. In UK law, they are then an adult, and if they have capacity, they are able to make their own healthcare decisions. Children between the ages of 16 and 17 are able to give consent for medical procedures that are in their best interests. However, if they are refusing treatment that is in their best interests, then there needs to be a legal injunction where the child is forced to have the treatment despite the fact that they aren't consenting for it, because they aren't legally able to withhold treatment that is in their best interests between that period. Below the age of 16, if a child is able to consent for treatment and they are deemed to fit certain criteria, and this is called Gillick competence, then they are still able to consent for treatment. So Gillick competence came from a case in the 1980s where a mother took the doctor and healthcare providers to court over providing her 15-year-old daughter with contraception. Off the back of that, children between the ages of 13 and 15 are able to give consent if they meet certain criteria. Gillick competency can apply to any aspect of a child's healthcare. It doesn't just apply to contraception, and there are certain criteria. There's no sort of set list or form that anyone needs to fill out, but it includes questions such as how old are they, how mature are they, do they have capacity, does the child understand what the treatment entails, including pros and cons and the long-term impact, does the child understand the risks, implications and consequences that could result from this decision, has the child understood the advice and information that they've been given, is the child aware of alternative options? Does the child possess the ability to explain the rationale behind their decision making? The reason this is important is that children below the age of 16 can have varying levels of their ability to assess decisions. And if they meet all of the criteria and the treatment is in their best interests and they meet Gillick competency, then they are able to consent for treatment. The Fraser guidelines are slightly different. So they are specifically guidelines for determining whether children who are below the age of 16 but above the age of 13 are able to consent to have contraceptive treatment. And the 5 points for that are: is the child mature and intelligent enough to understand the nature and implications of the treatment proposed? Is it impossible to persuade the child to tell their parents or let the doctor to tell them? Are they going to begin or continue having sexual intercourse with or without contraception? Are their physical and mental health likely to suffer due to them not getting the treatment? And is the advice or treatment in their best interests? And these Fraser guidelines can be applied without the child needing to tell their parents. And again, in the guidelines, you have to encourage the child to tell their parents to keep them involved, but it's not a necessity.